Good afternoon, everyone. Welcome to the webinar today. I'm just going to wait till 2 o'clock so that everyone can enter and we'll get started. Okay, so I can see a few of you entering. Welcome to this afternoon's webinar. Okay, so it's 2 o'clock now, so I'm going to get started. Welcome. All right, so we are looking at the National Early Warning Score today, so the news score, as you may have heard it being called. So it's the news score, National Early Warning Score. So we're looking at detecting and responding to clinical deterioration. So I'm going to go through a few slides with you, and then we're going to look on our care management system at where we can record the news information. So my name's Lucy Caldwell and I am a registered nurse. So I'm the RGN at QCS and I'm going to be hosting this webinar today. You will get a recording of this webinar afterwards. That will get you in a few days' time. You'll get a recording of the webinar. You will also get a resource booklet that we've done in line with this webinar, and you will also get a certificate of attendance for the webinar. So it's CPD accredited, so it will give you an hour's CPD certification, and that will get sent to all of the attendees that are here today. Just to make you aware that we do have a chat function. So as I go through the slides, I will periodically just have a look at the chat and see if there's any questions there. So feel free to put any questions that you need to in there. I shall try and answer them as I go, but also it's just worth knowing that we do collate all of these questions as well. So at the end, we will collate all these questions. I can answer them and send you out communication with the answers to all of your questions. So just to reiterate, if I don't get to answer your questions on this webinar, we will collate them. Just pop them in the chat and I'll get those answered for you. Okay. So as I say, we're looking at the National Early Warning Score, so the news score. And if we just pop on to the next slide, I'm going to tell you what we'll be covering today. Okay. So today, or for the next hour or so, we're going to be looking at what the National Early Warning Score is. So what it means, what it looks like. We're going to be looking at how the news works. We're going to be looking at the physiological parameters, so the measurements you need to take in order to get a news score. We're going to be looking at the scoring and the guidelines, so those that are in line with the Royal College of Practitioners. We're going to be looking at those and what they mean. And then I'm going to pop onto the system. So I'm going to go onto the care management system, the QCS care management system, and I'm just going to show you exactly how we can record that. All our measurements, get our scoring and what we need to do with it. So if we just go on to the next slide, we'll just look at what the National Early Warning Score is. Okay, so it was developed by the Royal College of Physicians and it was designed to improve the detection and the response to clinical deterioration in adults. So i.e. adults as in 16 years or above, and also in adults that aren't pregnant. There's a different score for them and there's a different score for children. So any females that are pregnant or any children, there's a different scoring system for them. This is for adults of 16 and above. So it's a standardised tool that assesses and responds to acute illness. So it's keeping your service users safe. And it was updated in 2017. So we have on our care management system the latest version of the National Early Warning Score. So you'll often hear that referred to as the News 2 score, simply because it's the second version. It was first produced in 2012 by the Royal College of Physicians, and it was updated, as I say, in 2017. So you might often hear it as the News 2. So if we go on to the next slide, we're going to look at how the news works. Okay, thank you. So the news, I'll refer to it as the news throughout rather than the National Early Warning Score. I'll refer to it as the news. So the news is a simple aggregate scoring system. So it's based on a simple aggregate scoring system where there's a score allocated to different measurements that you take of your service user. And it's measurements that are already routinely recorded in practice. We're going to look at what they are shortly. And it uses physiological measurements. They're the ones that we're going to look at each of those, what they mean in a few slides' time. And that the news chart can be used in different settings. So it can be used in acute care, so the hospital situation. It can be used in primary care, mental health, ambulance care, and care and community homes as well. So the version that we've got on our care management system, that is the care/community homes version. So in other words, there's slightly differing guidance for each, and we use the one for care and community homes. And we've also incorporated mental health guidelines into that too. So it's been adapted to use in the community. It's exactly the same scoring system as that you would see in the hospitals, and appropriate guidelines are given by the Royal College of Physicians. Okay, so it's used very broadly and has been for many years in hospital settings. It's just been branched out now into community settings so that we can detect any deteriorating health with our service users in the community. So if we go on to the next slide, I just want to look at the physiological parameters that form the basis of the scoring system. So the 6 parameters are, so the 6 measurements that we need to take in order to complete the news are respiration rate, and I'm going to be looking at each of these shortly just to sort of see exactly what I mean by these. But the 6 physiological parameters are respiration rate, oxygen saturation, so sometimes known as O2 sats, systolic blood pressure, so someone's blood pressure. I'm going to explain shortly what systolic means. Pulse rate, level of consciousness or any new confusion in somebody, and also the temperature. So those are the 6 measurements that we need to take in order to complete our news score and get the total score at the end with the guidelines about what we need to do. It's just worth noting actually at this point that on your QCS Compliance Centre, we do have policies and procedures on each of these parameters and how to take these measurements correctly, guidance on how to take these measurements. So it's just worth noting that that is all on the compliance system. So Leanne's asking, is pain no longer part of the scoring? So no, that's not on the National Early Warning Score. That's not part of the scoring system. That's not to say that you couldn't assess pain. You absolutely can assess pain if someone's health is deteriorating, but that doesn't form one of the parameters for the news score. Okay, so let's just delve into each of these individually and just see what we mean by each of these parameters. So if we could just go on to the next slide, we'll look at respiration rate. So when we are talking about respiration rate, we are talking about the number of breaths that someone takes per minute. Okay, so it's the number of breaths someone takes per minute, usually while at rest. And it's measured by counting how many times the chest rises in 1 minute. Okay, so that's how we would measure our respiration rate. And if we do that when they are at rest, that is a realistic respiration rate for that person. The normal respiration rate is 12 to 20 breaths per minute. Obviously, it differs in different adults, but the normal rest rate is 12 to 20 breaths per minute. So anything below 12 or anything above 25 breaths per minute, whilst that person is resting, could be a sign of an underlying health condition. Obviously, if that person has been doing some exercise or some form of movement before you take that rest rate, that might naturally be higher, which is why it's best to take that rest rate when they're at rest. Okay, if we go on to the next slide, we will look at oxygen saturation. So this is often referred to as oxygen saturation, O2 sats. and that is the blood oxygen level. So it's the amount of oxygen that's carried around in the body. So in your red blood cells, you've got a protein called hemoglobin, and that soaks up the oxygen and that carries that around your bodies, carries oxygen around the body. So the normal oxygen saturation rate is around 96 to 100%. And anything below 96% could be a sign of an underlying health condition. Now, there's something else that we need to just consider when we're looking at oxygen saturation. So if we just go on to the next slide, I just want to look at oxygen saturation for those with something called confirmed hypercapnic respiratory failure, so HRF as that's known. So hypercapnic respiratory failure is basically too much carbon dioxide in the blood. So carbon dioxide is a waste product, and if there isn't enough room in your blood cells to carry oxygen around, then it obviously can't absorb enough oxygen. And so this hypercapnic respiratory failure can be seen in diseases such as chronic obstructive pulmonary disorder is the most sort of common respiratory disease that we see. So COPD, that's also known as. So it can be seen in many sort of respiratory diseases, but it's a diagnosed condition, hypercapnic respiratory failure. And so in those people with hypercapnic respiratory failure, their oxygen saturation is naturally going to be lower as their normal state. Okay. So for that reason, and we'll look at this a bit further when we go on to the system, we have two scales. The news chart has two scales in place, one for those without hypercapnic respiratory failure and scale 2 for those with hypercapnic respiratory failure. So we have it defaulted to scale 1, but you can opt for scale 2 if a clinician has confirmed that they've got hypercapnic respiratory failure. So you just need to sort of document that in your notes if a medical person has confirmed hypercapnic respiratory failure. But we'll look at that when we go on to the system. It'll perhaps make a bit more sense. So if we then go on to the next slide, I just want to look at blood pressure. So blood pressure, taking blood pressure as a measurement. So systolic blood pressure is the pressure in the arteries when the heart pumps around the body. So when we talk about systolic blood pressure, that's the top reading. Normal blood pressure is considered to be between around 90/60 all the way to 120/80. So that's considered to be a sort of normal blood pressure. And it's that top measurement that is the systolic blood pressure. So that's the one that's taken into account with the news chart and the scoring. So just to explain what I mean about systolic. So systolic pressure is the pressure when your heart pushes blood around your body. Okay, so it's when the heart pumps blood around the body. And the diastolic pressure, which is the bottom reading, is when your heart rests between beats. So the one that's taken into consideration, they're both important, of course, but the one that's taken into consideration when we're doing the news score is the systolic blood pressure, so the top reading. Okay. If we go on to the next slide, we can look at pulse rate. So pulse rate is how many times the heart beats per minute. So it's often known as heart rate as well. That can be heart rate or pulse rate. And the normal pulse rate is 60 to 100 beats per minute. Anything outside of this range could be a sign of underlying health condition, of course. And as before, it's best to do that at rest. So rather than them having done some exercise or physical movement, it's best to do that when they're resting to get a realistic pulse rate at rest. Okay, and then if we go on to the next slide, we're going to be looking at level of consciousness or any new confusion. So that's just something that we will need to measure and record in our news scoring. So when we talk about consciousness, that is being aware of and responsive to one's surroundings. When we talk about confusion, That's not being able to think or speak clearly or quickly. It might be the person doesn't know where they are. They're struggling to pay attention or pay attention to or remember things. And they might see or hear things that aren't there. So when we're thinking about confusion when it comes to the National Early Warning Score, it's new onset confusion or new onset disorientation or agitation, where previously their mental state was normal, okay? Or it's worsening confusion, because, for example, someone that lives with dementia, it may be their usual sort of state to be quite confused. So they might be alert and conscious, and they might have their normal levels of confusion. It's if that confusion has become worse that we would want to class that as confused, that person is confused. And we'll look at the system, and I can explain it a bit deeper when we go on to that as well. And then the final slide in terms of the physiological measurements is temperature. And I notice we've got a couple of questions, so I shall answer those. But if we go on to the next slide, which is temperature, thank you. So temperature is the temperature of the body. So a normal temperature is around 36 to 38 degrees. And a high temperature is usually considered to be above 38 or 38 or above. And again, outside of this range could be a sign of an underlying health condition. So that's temperature. So before we go on to the next slide, I'm just going to see what questions we've got. So Morella, you're asking, is there any difference if someone is on oxygen versus air? Yeah, absolutely good question. And yes, there is. And the news score will score that differently if someone is on oxygen. And I will show you when we go onto the system, I'll show you exactly where you can put whether someone is on room air, so in other words, the air in the room around them, or whether they're on oxygen. And you can make a note of that as well on the system. But yes, that's a good question, and there is a difference, yes. And then, yeah, that's fine. Okay, that's all the questions. Great. So if we just go on to the next slide, we'll look at the measuring of these physiological parameters and just the importance of staff needing to be trained to take the measurements correctly. So nurses, for example, in the nursing home environment, for example, will be trained in line with the Royal Marsden Manual of Clinical Procedures. And so that's the sort of standard of clinical procedure. And anyone else that you would like to be trained within your service to take these measurements can be, and we do have, as I say, policies on the system that will guide you to how to do each of these measurements and how to take those properly. But yes, it is important that your staff are competent to take measurements correctly. So if we go on to the next slide now, thank you. So we'll just look at the scoring. And again, I'm going to show you this once we go on to the care management system and how that scoring looks. So every measurement that we've just talked about then gets a score for each measurement. So, okay, so as it's measured, a score is given. Okay, and then that score is aggregated. So in other words, the total score is given at the bottom. Okay, and that dictates what the guidelines are that are dictated by the Royal College of Physicians. So in line with Morella's question, if anyone is requiring supplemental oxygen, that goes up by 2 points. Okay, so yeah, that just take that into account. And the key emphasis for this scoring system is to have a system-wide standardisation of measurement and recording. So this is, as I say, already routinely recorded in hospitals. It's about bringing that into the community so that we can detect deteriorating health in the community, take action and improve outcomes for our service users. So if we just go on to the next slide. Okay, so we're going to go through now how to use the new score on the care management system. So the next few slides, we're just going to be looking at what areas on the system are available to record your news measurements, but then I'll pop onto the system and just show you that as well. So first of all, often people will do a set of baseline observations in their service. So it's good practice to do a set of measurements, all of these measurements on somebody when they are well. So often that's done on admission, a set of baseline obs, and we can pop those onto the alerts page. I'll show you where we put those. And yes, as I say, often that's done on admission. So it's a kind of that person's normal set of measurements. And the reason we put that onto the alerts page as a baseline set of obs is because we can pull that through into the news chart when a news score is taken, just to compare, because it might be that someone normally runs a low blood pressure. I've got a low blood pressure. It might be that someone normally does have a low blood pressure. So therefore, if it was 99/75 when you took their news score, it might be that they, normally run a low blood temperature. So it's just things to consider. It might be that they normally have a very high blood pressure, so therefore you would be concerned if that's come down quite a lot. But that's a good practice, just to record your baseline observations onto the system. And then if we go on to the next slide. So if you put a news chart in place for somebody, and again, I'll show you this, but we can create an action and attach a news chart to it. So for those of you that are familiar with our care management system, you can do two things. You could put a news chart in place and dip into and out of that as and when you need to, or when you feel that someone's health might be deteriorating. It might be that you want to put a frequency in there. So it might be a set of measurements that you take weekly as standard. But also the important thing is that you can dip into it as soon as you feel that someone's health might be deteriorating and get a score for them. So you then, once that's in place, record the 6 physiological parameters. You can record any associated notes with that, like, for example, what kind of oxygen mask they might be on, if they are on oxygen. And then you can click on the page to see the total score and just save that information. Okay, so if we go on to the next slide. So we use the news score on the system. That obviously gives us our score and tells us what we should do next. Okay, now these guidelines that are given to us from the Royal College of Physicians, so they are official guidance. Okay, now we get our score, that will dictate what we do, but also it's very important to tell somebody as well. So if you are concerned that someone is deteriorating, obviously you're going to do your news scoring, but also verbally tell someone too. You're going to be putting things on the care management system. It's going to be saving that information for you. It's going to be saving all your actions that have been taken, but also tell somebody. The news score gets shared to the operations dashboard, which I'll show you shortly. So the seniors can see what's going on across the service, so that they will see if there's a news score that's been put in place, but also tell somebody as well. So or verbalise, as soon as you can to a senior if you are worried about someone's deteriorating health. We've got an observations section on the main care plan page as well, which I'll show you to show you just sort of how we can look at previous news scores as well. And it's very important to remember that if the news score is above 5 or above, to think sepsis. Okay, now it tells you this in the guidelines anyway. It will sort of suggest that, but if a score is 5 or above, always think sepsis. And sepsis is the body's reaction to an infection. So it's kind of the body's overreaction to an infection, which can happen sometimes. And it can be very dangerous. It can prove fatal. And it's really important to identify that very quickly and to seek help, seek medical attention so that person can be treated as soon as possible. And a few of the symptoms of sepsis are things like slurred speech or confusion, for example, which is something that we're looking at when we're doing the news score. Extreme shivering, muscle pain, temperature, if they haven't passed urine for 24 hours, if they're really breathless, if someone really feels like, if they feel like they might die, if someone's got that feeling of sort of doom, that's often a sort of symptom of sepsis, and if the skin's mottled as well. So these are things that we need to think about. I'm not going to go too much into sepsis on this webinar, but it is really important that you think about sepsis. And I'll also point out as well that we do have fact sheets on sepsis in the Compliance Centre as well. So you can just identify those and sort of swat up on sepsis so that you know what you're looking for with that. But that's the really important thing about doing this news chart, is because that will give you a score. It will give you the confidence to be able to phone medical professionals, 999, whomever it might be. It will give you the confidence to call those people, to give a standardised score. They will recognise what that score is, and it just sort of helps in that sort of handover of that person. Okay, so if we go on to the next slide now. Okay, so there are reports on the system as well. News is a track and trigger tool. So it tracks scores and triggers actions if someone's health deteriorates. And we do have a range of observation reports, and one of these being the news score. So we can have a look at the current news score and also previous ones as well. And then if we go on to the next slide. Okay, so we'll be going on to the care management shortly, but it's just important to reiterate that action needs to be taken in line with the news guidance. So you will get official action to be taken, and you need to follow that action and sort of document what you've done. And it's also important to just mention at this stage as well that if you are doing a news score on someone because their health is deteriorating, so you're worried, so you're doing a news score on them, and the guidance will suggest at a certain level that you transfer that person to hospital. Now, in some cases, it might be inappropriate to send that person into hospital. For example, if that person's at the end of life, or if they've chosen not to go into hospital. And it's really, really important that if that is the case, and that has been a decision that's been made by the service user, then that needs to be put into a care plan. It needs to be recorded in a care plan that that person has made a decision not to go into hospital. Okay, so it's just important to have all that evidenced in your care plan. And you can discuss that scenario or those scenarios with the medical team and record as appropriate. And as I said before, like with sepsis, if you're concerned about a service user, tell someone immediately. So if you're concerned that someone's health is deteriorating, just tell someone immediately, as well as doing your news score. Okay, so we are going to go on to the care management system now. I'm just going to have a quick look and see if we've got any questions. Okay, so Christine, you're asking, how can we measure the oxygen levels when patients' fingers are very cold and cannot obtain any reading? Yeah, so that is a good question, and that is something that happens sometimes if a person's peripheries are kind of sort of shutting down due to cold, then it can be very difficult to get that oxygen. So it could be a good idea to try and warm that finger to sort of increase blood flow into the area, so therefore increasing oxygen into that part of the finger. So it's really important to try and warm that person's finger up. When I was working on the wards, and that would often happen, we would really try and you know, just encapsulate that person's finger and really try and sort of warm it up that way, and also just to, if you can, make sure that person's well hydrated as well. So I hope that answers your question for that. Okay, let's just have a quick look at the thread. Okay, Morella's asking, does it make any difference if we do a blood pressure while the resident is sitting up versus lying down? No, it doesn't. You can do the blood pressure when they're standing up, or sitting up rather, versus lying down. That's fine. The key thing is that they're rested. So yeah, that's the best way to do a blood pressure. So rather than after they've been doing a lot of exercise and movement, it's better if they can be rested for a little while beforehand. So whether you're doing it sitting up or lying down, that's absolutely fine. Okay. So I think that's all the questions for now. Tanya's asking, you can also get ear-SATs probes, can't you? Yes, I believe you can. That sort of goes on the lobe. So that could be something to consider. I believe that that is a slightly different device than the what would normally go on your finger. So it's not that you can put that on there. I think it's a slightly different device. I'd need to just double check that. But yes, I do believe that there are devices available that can take a reading from the ear. Okay. So Lavania's asking, what is the O2 saturation for COPD patients? So generally the target saturation for them would be between sort of 88 and 92%. But the thing I would advise with that, everyone's individual, and I would advise that you speak to your medical team about that and just find out what is this sort of target for them. But the scoring kicks in if they're on a scale 2, the scoring kicks in if it's below 88 to 92%. Okay, so I think now we'll go on to the care management system. As I say, I might have missed some of these questions, but these are going to be collated, so I shall make sure that I answer all of them. And I can communicate that out to you if I've missed any. But if we, I believe that's the end of the slides. I think it is, and I'm going to now share my screen and just go on to the care management system and just show you how we can do our new score. Okay, so let's just share my screen. Okay, there we go. So I'm hoping that you can all see my system. Okay, so this is Care Beans Lodge. So this is my demo site. So it's not any confidential information. It's my demo site. So it's a sample resident, Sally Webb, and we are going to do the news score on her. So her health's deteriorating, and we're going to do a news score. I'll show you a couple of different scenarios just so you can get a feel for it. So the first thing that we would need to do, and I would suggest we would do this with all of our residents or all of our service users, is put a news chart in place. Okay, so if we go into the actions, we can set up, I've already done this actually, I've done a news chart here. So I've set it up for this person. So for those of you out there or attending today that already use the care management system, just to remind you how that's done, we would click plus to add an action. We would call it our news chart. We'd link it to a physical health care plan, and we would attach in there the news 2 chart, which is down here. Okay, we can also put some support requirements in there as well. We can put a frequency on that if we wanted to. So it might be something that we want to do every week on that person because we do a set of obs on that person. It might be that we want to do it daily on someone, so depending on the person's need. Or it might be something that we just want to dip into and out of as and when we feel we need to do it. But while I'm on this pop-up, actually, if the guidelines when you've done a news score will tell you how often to do the observations. So it might be that it's suggested that you do them 4 hourly, so you can always come back into this and say we want to do this 4 hourly. Okay, so then you can put a frequency on it, and then it will remind staff to do it every 4 hours or whatever the news guidance is. Okay, so let me just show you what that looks like. So if we go into my interactions here, I just go into Sally. So you can see this on the device as well on your app. So we can see our news chart here. This is what it looks like. I have put it up here as well. There is the ability to pop it up here. But if I click onto that, it doesn't have any person-centered instructions on there. It's a kind of standalone chart. So what I would suggest is that you attach it to an action as I've done here. Because if I click into it and show you what I mean, there you go, we've got some person-centered instructions that we've put in place for that particular person. Okay, and we can also time it. If we put it onto an action, we can time that. So if I'm going to be told now that I need to do it every 4 hourly or 12 hourly or however often, I can adjust that frequency as to when it needs to be done. Okay, so this is what your news chart looks like. So you've got all these elements of parameters, your physiological parameters. So let's do the first one. Okay, I'll just fill each of these out and just show you what I mean. So each individual parameter has a separate score. What we're concerned about is the separate scores, but also the aggregate score, the total score at the end. Now you'll see at the moment, these icons are black, okay? And they will remain black if it's a low score. If it's slightly elevated, the score, it will go grey. And if it scores 3, then it will go orange. So that's quite significant if it's orange in that section. And it will tell you this in the guidelines, but if it goes orange in this section, it's just something that we need to be concerned about. So let's put the resps per minute, okay? So you can see here, if I put 14 resps, that's perfectly normal respiration rate, so it just stays like that. If I put that this person had a respiration rate of 28, that would go orange. So immediately I need to be concerned about that, and it's going to take that into consideration with my guidelines below. Oxygen saturation, I'm going to say that this person has an oxygen saturation of 99%. And shortly I'll tell you how to do these different scales as well, but we're just going to do this initial capture of information. Now it wants to know whether this person is on air, so room air, or it wants to know whether the person is on oxygen. So in answer to, I can't remember the name of the person that asked it, but in answer to your question about is there a difference between air and oxygen? Yes, there is. And this is where you would choose which that person is on oxygen or room air. So I'm going to say they're on room air. Okay, I've just tapped that. I'm going to say their blood pressure is 120. Well, let's say it's low, actually. Let's say it's 99/73. Okay, so that's gone grey because that's quite low. So it's given us a score. It's quite low, it's gone grey. It's not a massive alert, but it has gone grey there. We don't need to worry about remembering what these are because it's going to give us a total score at the end. Now we're going to look at beats per minute. So let's say there were 88 beats per minute. And then we're going to look at consciousness. Okay, so this is the ACVPU. Now, pain is one of these. I'm going to go through what each of these means. Pain is one of these. So this might be what you were thinking. I think was it Morella? This might be what you were thinking when you were talking about pain. But let me just explain what each one of these is, just so that you're aware. So it's one of these. You can't pick a few of them. It's one of these. Okay, so the first one is that this person is alert. Okay, so they're conscious, they're alert, they're responding, they're answering questions, they're conscious. Okay, the second one is, are they experiencing any confusion? Okay, so this would be new onset confusion. So if this person is newly confused, then yes, I would say that they were confused. It might be, as I say, that as I said before, that the person lives with dementia and they are normally confused. That's their normal state, is a state of confusion. So it might be that they are normally confused, but they're still alert. They're no more confused than they normally are. They're still alert. So I would click alert. But if I feel that their confusion is worsening, and this can be quite subtle, but if I feel that it's worsening, I would put confused. Okay, so I would say, if ever you're unsure, so this person has dementia or a cognitive impairment, they can sometimes be confused. I'm not sure whether they are more confused than normal. Err on the side of caution and say they're confused, okay, because that will give it a higher score. The V stands for, are they responding to voice only? Okay, so they might be sort of drowsy, but they are responding to your voice. So if I say, Sally, can you hear me? And Sally comes round and responds, she's responding to my voice. So she is dozy, sort of in and out of consciousness, but she's responding to my voice and she is then alert. It might be that she doesn't respond to my voice and she's actually only responding to pain stimuli. So if I pinched her earlobe, for example, and then she came round, then I would say that it was a pain response that she was having. Or it might be that she's unresponsive. So I would put that she was unresponsive. Okay, so it's one or the other of these. So I'm going to say that they are confused. Again, that's gone amber. So that's a high score there. And then the last one is the temperature. So let's say that they have got a temperature of 38.7 degrees. Okay, so that again, that's giving it a score. So then I just tapped and I've got this response here. Now there's a little box here where you can record any extra notes. So I might record the reasons why I've done it. Her health was deteriorated. She said she didn't feel well. She was a bit wobbly on her legs. I can record any notes as to the reasons why I've done this if I need to. Or it might be that I want, if she was on oxygen, I might want to just say what sort of oxygen mask she was using. It might be simple. It might be a nasal cannula or a simple mask. So you can record any details that you need to there. But the key thing is that you've put all these observations in and it's given you this guideline and response. Okay, so this has scored her 9. So immediately it's turned it into red text actually, and it will do at 5 or above. So immediately I'm thinking sepsis because it's above 5. So that's what my line of thought is there. Whether or not it's sepsis, she's poorly and she's deteriorating and she's got a score of 9, and this is classed as an emergency response threshold. And obviously depending on the score will depend what the guidelines are. But I have a list of things that I need to consider, and as I say, these are the Royal College of Physicians guidelines. So it says immediately inform a nominated nurse. You may not have a nurse. It may not be a nursing home. It may be a residential home and you've got carers taking the observations. So there is not a nominated nurse to call as such. But it's just giving you these guidelines as to what to do. So firstly, it's saying you need to immediately repeat the observations. So you need to do sort of constant monitoring of those. If there is a nurse available, inform the nominated nurse. It may be that a GP or a nurse review is required. So it might be that a district nurse may need to review that. You need to determine a management plan, so how we're going to look after that person. But the key thing is this one, urgent hospital transfer if appropriate. So we've put if, or the Royal College of Physicians has put if appropriate on there, because it might be, as we say, that someone is at the end of life and have chosen not to go into hospital, so therefore it would be inappropriate, but we would need to see that in our care plan. We've got more instructions here. If we click over the eye, this gives a bit more detail about what we need to do in line with that scoring. Okay, so let's just put a few different scores in here as well, just to see what it looks like. So for example, we just click oxygen. If they were on oxygen, that was changed. You can see that's added to the fact that they're on oxygen. I might record in here that they're on nasal cannula, just so that I've got a recording of what they're on. So you can adapt your scoring, and once you're happy with everything that's in there, you've seen that response that you need to do, you would simply save that. Okay, that then goes through to the operations dashboard, so seniors can see that as well. It might be that you're the nurse that's doing that news chart, so you can then sort of take the next action, or if you're the carer that's doing it and you want to report that to a senior, it does go through to the operations dashboard. So it goes through to a couple of places actually, the operations dashboard and also the service user page. So let's go on to our main care plan page. It goes into the observations section here. Okay, so if I look at her news 2, I can see the last time I did that, okay, and what score it was. And what I can then do, so it's showing me all her previous ones as well. And what I can do is go into this observation, investigate it further. I might want to check the care plans and see what sort of management plan is in place. I've got all my new scorings on the left here. I've also got her parameters, so I've got her baseline obs that have come through as well, so I can sort of compare those. But it's got all the information that I need to do, the guidance that I need to follow. I'd record my action taken in there, and I would save that. Okay, so I'd record what action I've taken and I would save that information. Okay, just put some X's in there, save. So that's my process. I'm going to record my news 2 observations. I'm going to get my score. I'm going to follow the guidelines. I'm going to make sure I've checked in all of their care plans, and I'm going to take the appropriate action. Okay. Now what I just want to do now is just show you where to put those baseline obs. So I'm going to show you where to put those baseline obs, and I'm going to show you how to look at reports as well. So if we go back into the service user, so we'll look at Sally again, back onto her main care plan page and into the alerts section. If I scroll down all the way to the bottom, there we go, we've got her usual parameters. So her baseline obs. So we simply say yes to these and we add it in. Now we've got ranges on here. It might be that a doctor, a GP or a district nurse or some kind of nurse practitioner has given you a range, their sort of ideal range. But if you haven't got a range, that's absolutely fine. You would just take a set of observations and pop them in the left here. So I've put in her normal blood pressure, what it was when she was admitted, her respiration rate, pulse rate, temperature and oxygen saturation. And it's at this stage here where it defaults to scale 1. But if we want it to go on to scale 2, which is if they've got that hypercapnic respiratory failure, we would simply tick that they're on scale 2, because that would adjust the scoring and take into consideration the fact that they've got COPD. But this does need to be diagnosed and instructed by a clinical practitioner and recorded in their care plan. If you hover over the eye, it will just remind you to do that. So it does default to scale 1. So it's just important that a clinical decision maker needs to have made that decision to put it onto a scale 2 and just to record that. So that's where you put your baseline obs. These are the ones that came through then that we saw for sort of compare and comparison. And then finally, I will show you, I'll go back onto the service user page, and I'm just going to show you the observations. So where we can have a look at all our previous news scores, and the latest one actually, but all our previous news scores that we've done. So if we go into the O for observation report, and if I click that, okay, so we've got here Sally Webb, and I'm going to click on her news chart. This defaults to the last month, but I might just want to look for the last week. I can put a date range in there if I want to. I might want to look for the past 2 months, but I put the date range in there. I'll leave it on a month. I'll generate the report, scroll down, and what this is going to show me is a graph with the dates on it and the score, what the score was. It's the date and the time it was done actually, and what the score was. And then it also has that tableized down here. So it's got the date, the time, who took those measurements, what the score was, any notes that were added, what the individual scores were actually, it gives here. And then, so what the total score is and what the individual score is, who it's been reviewed by, and the review note. Okay, you can print this information off. You can save it to a PDF or you can print it off. So if you needed to inform GP or district nurse or whomever about that, then you can do if they wanted to see the latest observation reports. Okay, and just actually while we're on this page, this is defaulted to Sally Webb because that's who I wanted to find the information out for, but I could also look at all of my service users and just see what their latest news score was. We've only done it on Sally actually in the past month, but if there was more, they would be under here as well. So anyone who's had a news score put in place, it would be under there as well. Okay, so that is the news score. I hope that's helped. I'm going to stop sharing now. Stop sharing. There we go. I'm going to go back to my slides. So we've got, let's just have a look and see if there's any questions. As I say, all of these questions we will collate and I will answer them thoroughly and properly. Even the ones that I've sort of answered on here, I'll answer them again and communicate that out to everybody just so that they've, just so that everyone's got the answers to those questions. You'll see the QR code on here as well. If you scan that, you can get a demo of the system if that's something that you'd be interested in. So Natasha's asking, will we send you slides and certificates? Yes, absolutely, we will do, Natasha. To all the attendees, we'll send out the recording, so the slides, the certificate of attendance, so that's a CPD certificate, and also a resource booklet. So basically everything that I've talked about today, we've just sort of put that into a little resource booklet for you. So yes, it seems that a lot of people are asking that about the slides, so that's fine. Yeah, they will come out to you in the next few days. Sue is asking, how can these be scored if we're not using the QCS recording system? So if there are paper versions. There are paper versions of the news chart. Obviously you need to do the calculations yourself. You'd need to plot it all on the paper. I would imagine they're available online. You're looking for an official document by the Royal College of Physicians, where there should be access to a paper document if you wanted to do it that way, if you haven't got the system. But if you are interested in looking at our system, we're more than happy to give you a demo of that. Okay, Rona is asking, is it a good decision to ring the emergency services if the score is 9? Okay, so the guidance will tell you what to do. So the guidance will say, I think on 9, because it's above 5, I can't remember what the exact guidance is for 9 off the top of my head, but I know that is a high score. I believe that's within the emergency threshold, and it will say urgent hospital transfer. So therefore, call 999, the emergency services, yeah. Okay, James is asking, what do we do where sepsis is the case, but the client doesn't want to go to hospital? So if that is the case, and the person their health is deteriorating, you've done a news score and it is suggesting that they go into hospital, so it's above 5, so it doesn't necessarily mean it's sepsis if it's 5 or above, but it could mean sepsis, so it's just important to consider that. But they're deteriorating, their health is deteriorating if it's 5 or above. They're poorly, but if that person has got mental capacity to make a decision about not wanting to go into hospital, then that is their decision to make, and it's just important that you document that where appropriate in your system. If someone hasn't got capacity to make that decision, then you would ascertain that person doesn't have capacity and make a decision in their best interests, which is likely to be going into hospital, unless a care plan has stated otherwise. But yes, if someone's got mental capacity to make a decision to not go into hospital, having had it explained to them how seriously poorly they may be, and had it explained to them what sepsis could look like and what the outcome of that might be, and they still decide not to go into hospital, then that is their decision to make in line with the Mental Capacity Act and the principles of the Mental Capacity Act. One of those being that we may believe it's a bad decision to make, but it's their decision to make. So I hope that answers that question for you. Okay, let's have a quick look and see if we've got any more. Let's look at the question thread. So Seshu's asking, what if only one parameter is high? So yeah, good question. So if one parameter is high, so let's say their breathing was like 28 respirators per minute, that is high, and that will score highly. That little symbol will go orange, and that's the top score is 3 for each parameter, so that would score 3. If everything else was perfectly normal, that would still score 3, and it would give you that guidance at the bottom, and it will say on that guidance if the symbol's gone orange, that is classed as a sort of a concern, so it will give you that in the guidance. It will let you know that. So Nicola's asking, we use Care Planner. Can this link in with this platform? I'm not sure about Care. No, I don't know. It's only our care management system. I'm afraid that we've got this on. I'm not sure about other care management systems. This is just something that we have permission to use from the Royal College of Physicians for our care management system. So Nicola's so Nicola's asking, is it free on QCS? So it does, it's not free, it does form part of our care management system. So if you wanted to have a look at that, if you scan the QR code, that will sort of lead you on to be able to get a demo on the system with costs and things, and they can go through those. No problem. That's all right, Natasha. Slides and certificates. So I think I'm hoping that I've captured everything, but I may well not have captured everything, but that's fine. We will, as I say, collate all those questions, and we will pop those in a communication for you where I'll answer everything thoroughly, even the things that I've answered already. We can go through those again. Okay, so I think that's everything. Okay, Abir is asking, can sepsis occur without a high temperature? Yes, it can. Yeah, that's one of the symptoms that might develop slightly later. But if it's not there, that doesn't mean they haven't got sepsis. There could be other symptoms as well, like if they've not been for a week, so not passed urine for 24 hours. And if they're suddenly confused, those things could indicate sepsis. And they might not yet be displaying a high temperature, but yeah, they could still have sepsis. So it is worth, you do need to sort of consider that. Okay, so I'm going to leave that there then. We're on 5 to 3 now, so I'm going to get these questions collated, and I shall send out a communication with that. And I hope that's been useful for everyone today. I hope that's made sense for everybody. And as I say, I'll get all those questions answered for you. You'll get your slides, you'll get your resource booklet, and you'll get your CPD certificate. So thanks for joining, everyone, and we'll see you next time.